Hey guys, welcome back to Pregnancy and Parenting Untangled. I'm your hostess, Hilary, the pregnancy nurse. Today, I'm super excited to share this one with you guys because early labor feels so tricky. You just feel alone. I mean, if you follow me, Hilary, the pregnancy nurse, you're likely looking to have your baby at a hospital and you're planning on the hospital sort of managing your birth. You're not looking to free birth, I would guess. And so managing early labor, deciding if you're in labor can be really tricky. And the sad news is your provider just does not have the time in the office to really go over all these signs. And a lot of them happen in hindsight. So I'm really excited to share these signs with you guys and to help you understand that labor usually doesn't happen all on its own, that other things contribute to it. So let's untangle it. As a reminder, the information on this podcast is only medical information and should not be taken as advice. If you have any questions about the information on this podcast, please speak with your provider. Now, there's a lot of you guys who are thinking these signs of labor are contractions, and that's the one that gets top billing, right? Which it should, because as you progress, that is going to get top billing. But what are the early signs of labor? What are the things you can be watching for besides contractions? We're going to talk about those today. Before we get going, you want to be learning from an expert, and I am one. I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am here to help explain the complex topic of labor in easy ways to understand so that you can know what you're watching for. If you're interested in learning more about the signs of labor, this video is sponsored by the online prenatal class for couples. It has an entire chapter on what to watch for at home and also how to labor at home so that you can spend as little time in the hospital as possible, because that is a big win from the pregnancy nurse. Yeah, that's right. The pregnancy nurse thinks laboring at home is a big win. So come join me in the online prenatal class for couples. Okay, the first one is cramping. So it's really going to feel very much like when you would start your period, from the age 14 on. And a lot of people are caught off guard by that. Now, if you're earlier in pregnancy, you've been wanting to watch for cramping the whole time. If you're 32 weeks and feeling cramping, that's not a great sign. You want to talk with your provider. Of course, these signs of labor are things that aren't so worrisome once you're past 36, 37 weeks. In addition to the cramping, you might get some lower back pain as well. Now, it's not unusual to really feel that frequently in your last month of pregnancy. And these signs are also things that you might feel on and off during the last month of pregnancy. And the way you know that it's turning into labor is they get closer together, stronger, more painful. That's how you know that labor's coming. But these early signs can show up days, weeks in advance of you actually going into labor. Now, here's one I hadn't really noticed, but studies have shown that certain people feel an overwhelming wave of fatigue before they go into labor. Interesting. I mean, it totally makes sense. Your body, if it knows labor is going to be coming, is going to want to be like, hey girl, get some rest because we're going to be busy in here. So it does make sense. Not everyone feels it. And I think it would be really confusing because as you get into that last month of pregnancy, I felt like as soon as I opened my eyes, I had an overwhelming wave of fatigue. But when you look at the studies, people said they noticed they were extra tired before they went into labor. So that could be something to watch for as well. One of the other big signs can be losing your mucus plug. Now, the mucus plug is basically at the end of this uterus. This is your uterus, by the way. So it's just a collection of cells and, yes, mucus that hangs out here and kind of corks the bottom of your uterus. Now, as that cervix starts to open up, as you can imagine, the cork doesn't have as much to hold on to, and so sometimes it falls out. Usually you notice it in the toilet, after you pee, or when you wipe. And yes, I gagged when I saw mine, and I've only seen my mucus plug on one of 3 babies. So not everybody has it come out or notices it. But losing that mucus plug can be an indicator that you should think that labor is going to be in the next week or so. This does not mean that you go into labor and delivery. I've had people show up in labor and delivery who said my mucus plug came out. I'm obviously here to have my baby. They're not having contractions. They aren't having any other signs of labor. It's just that their mucus plug came out. Also, please do not take a picture of it. Well, I mean, you can take a picture, but I don't need to see it. And please, pro tip, please do not bring it in a Tupperware container to us. Fish it out of the toilet and bring it to, please don't. Please don't do that. There's no need. We believe you. Okay, another one that sort of correlates with the mucus plug is changes in discharge. So as you get later into pregnancy, things are just going to be different down there. A lot of people end up wearing a pad the last few weeks of pregnancy because there's just stuff going on down there. Might be a little bit more watery, might be a little thicker, might just not be very fun in your panties. So changes in discharge can be a sign that labor is coming, but it's also very normal in those last few weeks of pregnancy. Now, if your discharge is watery and it just keeps coming out, that could be an indicator that your water has broken. And so that's something you want to talk with your provider about. I think it's valid to bring this up to your provider if you're feeling wetness frequently. Usually in the office, they can check to make sure that it's not your water that's broken, because that's something that we want to know, because it can be a chance of infection. Okay, now one of the last ones not a lot of people associate with is stomach upset. Now, you can get stomach upset for a variety of reasons in that last month of pregnancy, but a lot of people, as they head into labor, notice nausea, maybe vomiting, diarrhea, and it makes sense. Your GI system is very close to the baby canal, and it is going to want to clear out so that baby has more room to get down the birth canal. Your body also doesn't want to expend a lot of energy on digesting food when it's also trying to get a baby out. So your body's thinking, I'm going to need to prioritize a baby. Let's get this food out of our system. Of course, it could also be the Chinese food that you had last night. But when you're starting to see a lot of these things come together, your mucus plug fell out, your discharge is different, your stomach is a little bit upset. These things are going to start to pile up, and you're going to start to think, yeah, maybe something's happening. For me personally, on the day that I went into labor, I had what we call generalized malaise. It's just, I did not feel great in like a special way that I did not feel great in the other days before I had my baby. So I think that can be another sign that birth is coming. As I said before, it's complicated. These signs can show up when nothing is happening, and they can also show up when something is happening. But you're just keeping an eye on them. And again, I don't recommend like counting how many contractions you have until you're noticing more than like 10 in an hour. Then you can start to get out the contraction timer. Pro tip, did you know the Count the Kicks app actually has a contraction timer as well? So it's like an all-purpose app, because of course, if you are in your third trimester, you're going to want to be doing kick counts, because it saves 1 in 3 stillbirths. Okay, there is so much to know about labor. This is only talking about early labor and the signs to watch for. And of course, you want to stay home during early labor unless something's feeling fishy, because that is going to be the best place for you to hang out. And come join me in the online prenatal class for couples, where we tell you what you can be doing at home to promote labor, as well as when you should be heading to the hospital or calling your provider to maybe thinking it's time to upgrade your care to the hospital. What other signs have you heard about for early labor? Tell us in the comments. I would love to have a discussion about it. Thanks so much for joining me, and come follow me, because I would love to hang out with you for the rest of your pregnancy.